Kroger. And then expected to join us a little bit later will be Nadam Heem. He is with Zix Pharmacy. So with that being said, we're going to go ahead and turn it over to Health Commissioner Cooper to provide us with an update. Jeff?
All right, thank you, Dan. It never fails that there's a siren that goes by right when we're getting ready to offer comments. Well, first of all, I'd like to thank our community partners for being here today. We've all been at this for almost a year now, and it's a very exciting time for all of us. So thank you to everyone who's here today to share updates with our community. And that includes our media partners, because our ability to convey this information is very difficult without you. We rely on you to make sure that it goes throughout Montgomery County. I think the first thing we'd like to do is just kind of give a brief overview of where we've come from the past year. Keep in mind that we've been tracking data for almost a year now. And the reality of this pandemic is that almost 41,000 of our residents in Montgomery County have been diagnosed with COVID-19. We know that number is very likely much larger than that, because oftentimes early on there was no testing available, and not everyone who's ill even now gets tested. So documented, almost 41,000 of our residents have had COVID-19 disease. Unfortunately, about 3,500, a little over 3,500 of those individuals have been hospitalized, and we have lost 396 of our citizens over the life of this pandemic. And so our hearts go out to their families and friends and neighbors who obviously are mourning those losses. When you look at our data, we're pretty consistent with the other urban counties in the state. So based on our population, you would anticipate that we would have a large number of cases, and that indeed bears true. So we have the fourth highest number of cases regarding COVID-19 among all 88 counties in Ohio. On the public health advisory color-coded system, we remain as a county at risk level 3. We are one of 83 counties who are risk level 3 red, and we learned today that one county, Hamilton County, has transitioned to risk level 4 purple. So all counties in Ohio, all 88, if you look at that map, exceed the CDC's high incidence threshold of more than 100 cases per 100,000 population. And we've tracked our rates really since the July time period when that advisory system was established. And we saw an increase in August. We then started to drop back down and then started back up again in an upward trend around late September, early October, peaking near early December. Then again, mid-December, we started to increase again. We did not really see a significant spike after the Christmas and New Year's holidays. However, just between this week and last week, our 2-week case rate has gone from 694 cases per 100,000 population to now 792 cases per 100,000 population. So the point of all the data is to say that this virus is still circulating within the community, and we can't let our guard down. Yes, we are very excited as a community and as a system of partners that we now have a vaccine to help combat this pandemic. But we also need to continue those things we've been doing for the last year, and that's social distancing, masking, washing our hands, covering our cough, working remotely where possible, etc. So just because we have a vaccine doesn't mean that we can let up in those other foundational tenets of public health and disease control. So let's talk just a little bit about where we are so far with the rollout of COVID-19 vaccine in this community. And I think it bears noting that Ohio has a phased approach, and we're all familiar with that, but it's good to reinforce it. Phase 1 is being very purposeful because the supply is limited. So we are currently in phase 1. As the supply increases, it's very likely over the coming months we would transition to phase 2 in those population groups. And then as more and more vaccine becomes widely available throughout this year, our hope, we would be able to offer the vaccine to any Ohioan and any Montgomery County resident who wants it. But the reality is right now, the supply of vaccine is limited. And as such, the state of Ohio has established a phased approach for allocation of the initial supplies of this vaccine. So phase 1A was designed by the state to, and pardon me for just a moment, phase 1A was designed by the state to provide protection for healthcare providers, as well as protect those citizens oftentimes deemed most vulnerable and most at risk of serious illness and death. And those are essentially our individuals or our residents in long-term care facilities, such as nursing homes and assisted living facilities. So phase 1A began to roll out right around the Christmas time period. And so we were able to provide vaccine from the state to hospitals to provide the vaccine to their staff, to pharmacies, specifically in our area, 2 pharmacies, CVS and Walgreens, who are administering vaccine at long-term care facilities who are part of a national pharmacy partnership program. And then vaccine for phase 1A came to local health departments, such as Public Health Dayton and Montgomery County, to cover all of the groups who are not being covered by hospitals and the national pharmacy program. And so that phase 1A allocation and administration has been ongoing now for several weeks. For Public Health Dayton and Montgomery County, that means that we are providing vaccines to EMS responders, specifically paramedics and EMTs. We are covering long-term care facilities not covered by the pharmacy program. We are covering group homes for staff and residents, as well as residential care facilities for individuals with developmental disabilities, as well as mental health and substance use disorders. We are providing the vaccine to home health staff, and then to medical staff, for the most part, in a variety of outpatient settings, such as our federally qualified health centers, primary care practitioners not associated with the hospital system, urgent care centers, our K-12 school nurses, dialysis centers, dental providers, as well as hospice staff. And then as more and more vaccine becomes available, we will be able to open up phase 1A to other groups and other congregate settings, as well as other healthcare providers. Because the thing to keep in mind is that there are roughly 50 to 70,000 individuals within Montgomery County who fall within that phase 1A group. So a key point is that we will be continuing to move forward with the phase 1A vaccination program, now in conjunction with rolling out initially phase 1B. So when we look at phase 1B, the governor of our state has set 2 primary goals. Number 1, save lives. And that means let's get the vaccine to those most vulnerable, most at risk. And then also get our K-12 children back in school in person by March 1st. So obviously the populations that will fall within phase 1B are Ohioans who are 65 years of age and older, individuals who are living with severe congenital, developmental, and or early onset medical disorders, and we have a list of who falls within those categories, or at least those categories. And then adults who work in our K-12 schools. So when we look at the population that represents within our community for Montgomery County, we know that we have approximately 97,000 individuals aged 65 and older. And we know that for adults working in schools, that number is somewhere around 11 to 12,000 individuals. And then we're currently working through getting some estimates regarding individuals with severe medical disorders. So obviously we are going to be in phase 1A and now phase 1B for multiple months because of a limited supply of vaccine. So the way this is being rolled out for phase 1B statewide is that we will begin with specific age groups regarding 65 and older. So beginning January 19th, individuals ages 80 and older will be eligible for the vaccine. And the next week, January 25th, individuals 75 years of age and older, as well as individuals with severe medical conditions will be eligible for the vaccine. By February 1st, that interval will drop to individuals ages 70 and older, as well as we will begin the rollout of vaccine to adults working in K-12 schools. And then on February 8th, the ages will be anyone 65 years of age and older. And the good thing about phase 1B is that unlike phase 1A, when it was just a few pharmacies with the National Partnership Program, hospitals, and public health, now we have additional community partners who are receiving the vaccine. So we have our federally qualified health center partners here today who are receiving vaccine for phase 1B. And we also have several retail pharmacies independent of the National Partnership Program who are also receiving vaccine. No, none of us are receiving the quantity per se that we want. And we recognize that this isn't a long-term endeavor to be able to cover our populations, but at least it's starting. And there's a sense of hope and a sense of purpose that we all have in terms of quickly getting this vaccine into the community. And so with that, Dan, if we could have, I think it'd probably be good to have our medical director, Dr. Michael Doan, just talk briefly about the two vaccines that are available to our community.
Okay, Dr. Doan.
Thank you, Dan. I just have a quick comment regarding the vaccines that are available. We have been using the Moderna vaccine in Montgomery County, and now as the places that are going to be doing vaccines and as we expand the categories eligible for vaccination, the Pfizer vaccine is also going to be available. Those vaccines are both the same type of vaccine, but from the standpoint of those of us getting vaccines, the difference really is follow-up. The second dose of the Moderna vaccine is at 28 days, and the Pfizer vaccine is at 21 days. Other than that, the vaccines are both effective. They have very similar and low risks of serious problems. The Pfizer vaccine that's coming, in fact, they estimate that the serious allergic reactions are about 11 per million people they get vaccinated. It's what it's been so far in the United States. The other update, I guess, is that the Johnson & Johnson vaccine, it's anticipated that they'll be able to give their information to the Food and Drug Administration in about 2 weeks or so that it may well be that next month in February, that we're going to have a third vaccine available within the county. And so this is very hopeful that we'll get larger and larger quantities of vaccine. I'll take it back to you then, Dan.
Thank you very much. I think at this point, we're going to go into the explanation of each partner, including public health, in terms of how and where and when that vaccine is going to be available. We just want to make note that the vaccine is being distributed by the Ohio Department of Health to all of these vaccine providers. So each individual provider is getting their own independent supply to be used in their clinics and the other areas where they're distributing the vaccine. So I'm going to turn it back over to Jeff, and Jeff can walk us through exactly what public health will be doing with its portion this coming week, and then we'll go to our other partners. Jeff?
Sure, thank you, Dan. So I believe our community is fully aware of the fact that public health has been operating our vaccination clinic for phase 1A population groups at the Dayton Convention Center. And so consistent with that, we will begin initially, not exclusively, but long-term exclusively, but initially we will offer our first phase 1B vaccine also at the Dayton Convention Center. And that will be next Wednesday, January 20th, from 8 a.m. to 4 p.m. And it will be for individuals age 80 and older who either live or work in Montgomery County. And so we will have information starting tomorrow morning at 8:30 on our website. as well as individuals can call in to our information line at area code 937-225-6217 to help them register. As we've been saying, and hopefully everyone understands, this is going to be a long-term endeavor. And we all need to demonstrate patience and understanding regarding limited supply of vaccine. So we have received a very small allocation to begin our first phase 1B vaccinations. We have roughly 600 doses for public health that we will make available next Wednesday to individuals 80 and older who have the ability to get to the convention center to receive the vaccine. So you need to show proof of age. Obviously, that's a state requirement. And we'll post all of this information on our website, as well as Dan will be sending this out to all of our media partners. Yes, individuals can be accompanied by a caregiver or someone helping them, but we're only able to offer the vaccine to individuals ages 80 and older. We will ensure that there is masking, social distancing within our pod, similar to phase 1A pod, and everyone coming to receive the vaccine will have the opportunity to be seated and will not be expected to stand and or walk through the pod. They'll be able to be seated during the vaccination and waiting process. And so we'll have plenty of our staff there to be able to provide this vaccination free of charge. It's also important to note that one of our guiding principles for public health is during this entire vaccination program, we want to make sure that availability of vaccine for our citizens is fair and equitable. And that's a guiding principle for this health department. So we will be allocating around 200 doses of the total that we've received for a mobile vaccination team. And we may actually have more than one mobile vaccination team, but we're going to do very targeted outreach to populations that have historically experienced barriers to access to healthcare or have been disproportionately affected by this COVID-19 pandemic. So that includes Montgomery County's African American population, other minority populations, marginalized populations, as well as individuals that experience transportation barriers or other health-related circumstances that make it very difficult for them to get to this vaccine. For example, homebound individuals. So we want to do this fair, equitably, and over time be able to offer it to all of our citizens as the supply increases. So that's a quick update for how public health will at least initially begin allocating and administering this vaccine within Montgomery County. As we receive more vaccine, we will be able to look at other sites throughout the county, as well as other models of delivering it. Dan, I'll turn it back to you.
Okay, thanks, Jeff. And to illustrate part of the state of Ohio's program, that they want to be able to make sure that that vaccine is available at as many locations as possible. So with that being said, we're going to turn it over to one of our partners here who's going to talk about another way that you can get the vaccine. And we're going to go now to Gina McFarlane-L with Five Rivers Health Center. Gina.
Hi, I'm Gina McFarlane-L. I'm the CEO of Five Rivers Health Centers. We are one of the several federally qualified health centers within Montgomery County, and we're excited to be a part of this partnership to get the vaccine out to our 80-year-olds and older in the next week. And so at our Family Health Center location, which is located at 2261 Philadelphia Drive on the corners of Salem Avenue and Philadelphia, we will be providing the vaccine. We are doing it from a appointment only schedule. So starting on Sunday, we will have our live opportunity for patients to sign up, and we will begin the vaccine on Thursday afternoon. We will also have vaccine available for Friday as well as Saturday morning. If you go to our website, www.fiverivershealthcenters.org, starting Sunday morning, you'll be able to sign up for the vaccine and make an appointment. If you are not able to use a computer, we'll also have a telephone number that you could use, as well as we will also have an email address that will also be available that you can get more information. At this particular time, again, we're focusing on the 80 and older. We too have a limited supply of vaccine. And even though Five Rivers has many locations, we will only be doing this at our location on Philadelphia Drive.
Okay, thank you very much, Gina. And since we started with the FQHCs, we're going to go ahead and finish up with that before we get to Lisa. And we'll go now to Dr. Anna Roepker. She's with the Community Health Centers of Greater Dayton. Anna.
Thank you, Dan. So I am the medical director at Community Health Centers of Greater Dayton, and we are receiving vaccine for all 6 of our locations, and we will be giving it at all 6 of our locations. However, we ask that you call our central scheduling to make an appointment. And that phone number is 937-461-6869. And they will help you schedule at the location that is closest to you and with the time that is works best for you. So that's our plan for the first week.
Thank you. And let's go ahead now and turn it over to Lisa Henderson, who's with the Greater Dayton Area Hospital Association, and she's representing all of our hospital partners today. Lisa.
Thank you, Dan. I just echo, we are so excited about the path forward that the vaccine provides for all of us. So as Jeff mentioned earlier, our hospitals have been working diligently to complete phase 1A vaccinations, and across our region, they've done over 15,000 first doses. So they are meeting the governor's expectations in terms of completing these vaccinations across our region. The other piece that I know was touched on in earlier remarks is just around education about the safety and the efficacy of the vaccine. So we know there's endless information available online, but our hospitals, like public health, are using those reliable data sources such as CDC and ODH to make sure that we have accurate, transparent information about the vaccine safety. So as individuals have facts about the vaccine, it's our hope that they will receive it to protect their health and that of their family and friends. The other piece I just want to emphasize is that, like so many parts of this pandemic, our hospitals have been working across organization lines on vaccine coordination amidst a lot of unknowns. So as soon as information becomes available, they're working within those guidelines. But just like, was mentioned earlier, there are a lot of state and federal rules surrounding vaccinations. So who's eligible and how they're made available, our hospitals are really working within those rules as quickly as they are made available. So all providers, regardless of hospital or not, are reporting into that state data system, which provides updates to the governor's vaccine dashboard. So we know that transparency is important, and we're all working together to meet his goal and ours to save lives, starting with those at highest risk. So as the governor noted on his briefing earlier, and as everyone has mentioned, our initial allotment is very limited, and that's same in the state as well as here in our region. In the phase 1B rollout, our hospitals are receiving only a portion of those doses, which is just a small fraction of what's being distributed, and we know won't meet the demand in the first week or two. So we know there are a lot of questions about how and where to access the vaccine. We appreciate all the information that's been shared so far. We ask that you please do not call or walk into the hospitals expecting a vaccine, but that you visit our hospital website for more information, and that will be regularly updated on the process. All of our hospitals are requiring that registration or scheduling a visit, and all of those details are available online. Particularly in Montgomery County, if you go to premierhealth.com/vaccine, you'll be able to see details for their vaccination sites at Miami Valley Hospital and Miami Valley South. And for Kettering, you'll be able to go to ketteringhealth.org/coronavirus for the details on their vaccine clinic on East Dorothy Lane. So they are working diligently to make sure that, you know, all information is up to date on those sites. And we just really encourage you to visit those, gain access about what's available and where. So again, we are just so encouraged by the efficacy, the safety, the importance of this vaccine. But as was said before, we just ask for your patience as we all work together to distribute this vaccine. And our hospitals are here for you. They are open in safe places and are working together in just unprecedented ways, and vaccine included. So thank you so much for all of your work. And I will turn it back over to you, Dan.
Thank you very much, Lisa, and another great partner we have. And now we're going to go to another segment of partners here to show how widespread that we're working to make this vaccine throughout the state of Ohio is our pharmacy partner. So first up, we have Erin Rolfus from Kroger. Erin.
Hi, thank you. Thanks for having us here today. You know, we've been really excited to be the provider for folks food all throughout this process. And now we're excited to join that next step with providing the vaccine. So underlying a lot of what everyone has said so far, a very limited supply of vaccine that's coming to us next week, following the Ohio health guidelines of who we're going to be vaccinating. So I won't repeat that since you've heard it a couple of times already, but the important news of how to sign up for an appointment for the vaccine, I want to underline that these two resources will not be available until this coming Saturday. But starting Saturday, January 16th, folks can log on to www.kroger.com/Ohio COVID vaccine. And that's all one word with no underscores in the middle. Or you can call 866-211-5320. The latest information about availability will be available in both of those places, and you can go there to schedule an appointment.
Okay, very good. Thank you, Erin. And we do anticipate that the supply of vaccine will be growing as we go along, and it's great to have all these partners with us. And I see we have one more partner here from Zix Pharmacy. Nadam Heem. Nadam, can you tell us what Zix has for us? You are muted, Nadam. Nadam, you need to unmute.
Okay, good.
There you go.
Thank you, Dan. At Zix, we started our vaccination since last week or 2 weeks ago, starting with the MRDD. And it's been real successful, and public health has been very instrumental in supplying us with some of the supplies. And now that we're moving into phase 1B, we have limited allocation, but then we are going to the congregate building like St. Mary's Development Corporation, particularly the elderly patients. So those are the people that once we receive our allocation this week, we should be able to go to them and do the vaccination. Or we might have somewhere within the community where we can do it. So that's what we are doing right now. There are still a lot of unknowns, but on our website, people can go there to find information about what level of administration we'll be doing, or if we have anything in stock.
Okay, very good. And that's a good point to make. And this goes for everybody, I'm sure, that the best place of information and the quickest and easiest will be to go to all of the partners' websites to stay up to date with the very latest. It is changing very rapidly, and it's changing week to week as the different amounts of vaccine is rolled out. With that being said, I think we're ready to open up to questions here from our media partners. So if anybody has a question for anybody in the panel.
This is for either Dan or Jeff. Jeff, can you just talk about why it's important for everyone to realize that you do not want to go and stand in line at any of your partner locations? You need to register, you need to make an appointment because of the fact of the limited supply. Can you just go back over that?
You want to do that, Dan, or you want me to do that?
Well, yeah, I mean, all the registration process is available on the partner's website. And it is particularly important with this group 80 and up, because we understand there's going to be challenges for people in that age group potentially to stand for any period of time. Some people will have a challenge with as little as 30 minutes. So we're making that available through a registration process to try to make it as comfortable and convenient for them as possible. And the particular conditions for each phase of the vaccine as we go along, that may be updated and changed as more vaccine becomes available and the different age groups come into play. But that's where we're at right now this week.
Yeah, and I would also add that the last thing we want, it's already frustrating enough as a community to know that we're not able to offer the vaccine to everyone that falls within the population groups that are eligible. We just don't have enough supply. The last thing we want is individuals to then experience additional frustration by driving to a site, standing in line, and then being turned away because there's not enough vaccine. That's just not fun or fair to anyone. So the reality is we have to go through a registration and an appointment process because the supplies are so limited.
I'm not sure who would be the best to answer this question, but you mentioned the safety and efficacy of the vaccine. Obviously, there's a little bit of a reluctance in the community to get the vaccine, you know, in some cohorts. But I don't know if there's a way to, you know, maybe reinforce that this is safe, or if that's what I'm assuming. I'm not sure who would be the best to take that on, but I think that's an important thing for people, that reassurance that this vaccine is safe.
I think Dr. Doan can offer us something on that.
And I believe all of the partners here today probably should offer their perspective if they're interested in doing so, because I think the community should hear from all of us in terms of vaccine safety.
I think, you know, one of the things I said to Dan is how many ways can we say that it's safe and effective? And I think that people have concerns in different areas. One is that it was developed so rapidly. They feel like, in fact, all of the steps are there in the approval process from the Food and Drug Administration. It's an emergency process, but it's the exactly same criteria they look at for final approval and the same considerations that the independent advisory groups make. And so when they look at it, they really haven't skipped any steps, and they haven't done anything different in the process other than just kind of squashing it up because we've got so many people dying, and the vaccine can be able to help with that. The safety of the vaccine, as I think I mentioned, the one thing that was sort of alarming was when they first used it in the United Kingdom, they had people with anaphylaxis, a very severe allergic reaction on their first day. And the concern about that has not been sort of seen in subsequent experience. In the first 2 million or so vaccines given in the United States, there were a handful of anaphylaxis episodes. They have a much better understanding of it now, so they're weeding out the people that might be possible people for experiencing that. And the rate was relatively low, about 10 or 11 people per million people that got the vaccine. The other problems that we've seen seem to be, in fact, a little bit less than they were in the trials. 40,000 some people got this vaccine in both of the trials. And the thing that happens when you release it to the general population is sometimes if there's some rare problem, you'll start to see it. Well, we haven't seen a rare problem in a couple million vaccines that we've had so far given to people. And the number of people reporting difficulties seems to be less than it was in the actual studies itself. So from that standpoint, it looks like it's going to perform better in terms of safety and comfort for people than what we might have anticipated from the phase 3 studies even.
And I would also add to that public health has a outreach team that's working to try to overcome some of the vaccine hesitancy that we know has been around for other vaccines, and that's particularly in the African American communities. So we're reaching out to them in a variety of ways to help that group understand the safety of it and understand what's going on, so that to help relieve some of that hesitancy. We do have, I see an online or a question in the chat there that I want to address real quickly. The question is if people who are age 65 and up can pre-register for any other vaccines. As far as public health goes right now, the only registration we're going to be taking starting tomorrow is for that 80 and up group. And then as we go week to week and we determine the vaccine amount, we'll make adjustments accordingly. I don't know if anybody else has anything to add to that. Is everyone else the same with that answer?
We are the same at Community Health Centers of Greater Dayton.
Okay, Gino,
I
did you
put
have
our
something?
answer in the chat that once we have the allotment weeks from now, patients and community members will be able to pre-register for appointment slots as well. And I too want to just kind of echo with regards to some of our patients, African-American patients within the community. I mean, we know the efficacy of this particular vaccine has been great. It's just a matter of people trusting the data. There's a couple of groups within the community who will be putting more information out in the next couple of weeks to help more churches, more African Americans, more people that English is not their first language, understand a little bit more on how safe this vaccine is. And we're encouraging them to use it.
So I would also like to offer a perspective also on the safety issue. When you look at the foundational tenets of public health and how our organizational culture, we serve this community. We focus on and help those who are less fortunate and oftentimes most vulnerable. Yes, we serve all citizens. And we do that by being transparent and truthful in all interactions. And so over time, we've always used data and we've told the truth to our community, whether it's the opioid crisis or infant mortality or food safety or the hepatitis A outbreak that we experienced, or for example, the 2009 H1N1 influenza pandemic regarding that vaccine. And that was a vaccine that required emergency use authorization as well. We've always told our community the truth, and it would be unconscionable for this health department to recommend someone to receive the vaccine if we thought it wasn't safe.
And Jeff, one final note on vaccine hesitancy. We do have a survey on our public health website where we're asking people to fill that survey out and give us your attitudes and feelings about the vaccine so we can try to learn from that and move forward and make that vaccine available to everyone as much as possible. We have another question in the chat that I think we need to get to, and that regards the second dose of the vaccine. As we know that each vaccine at this point requires 2 doses, and you must get the same dose of the same vaccine. So Moderna, Pfizer. As far as the registration process goes, when the people come through the public health clinic, they will pre-register starting tomorrow. Once you go through that process, when you go and get your vaccination, then you will be put in the queue to be getting the second vaccination at the appropriate time. So you will then be notified directly from us when the next time would be available for you to come back. And if anyone else has any different procedure and wants to add anything to that, let us know. Okay, so I think everyone, during that registration process, we're capturing your contact info, and then we're going to get back to you with your next time available to you. Gino, I see you raise your hand there.
Yeah.
I was gonna.
Oh, sorry.
Our goal is to set up that second appointment while you are there, so that you will know the week of the next time you'll be available for that second dose. Again, we'll be waiting for that next allotment to come from the state, but we will set up that second appointment while you are right there after you received your first dose.
Very good. Gino?
Yeah, I know you mentioned the population size of people who are in this age range, and I know you said the supply of these vaccines is limited, but I didn't hear an exact number of how much you have initially, and then also what's the goal in the first week of this age range of 80 plus. So how many vaccines do you have ready to go this first week, and how many are you hoping to administer?
I can answer that for public health. We will receive next week between Monday and Wednesday, well, Monday's a holiday, between Tuesday and Wednesday, 800 doses for phase 1B for individuals ages 80 and older. We will use all of that within a 7-day period. all providers throughout the state of Ohio who are receiving vaccine for phase 1B are required to begin administering the vaccine within 24 hours of receipt and then complete all vaccinations within 7 days.
But is there a grand total for Montgomery County, all of these different health systems and pharmacy partners, and of how much?
We're, the way that it's being distributed is it's going directly to the vaccine providers. So each one's going to have their own count. So we're going to have to rely on them to provide those numbers. If you have those numbers here for the people on the call, we can provide them to you now.
Five Rivers Health Center was allotted 600 doses.
Community Health Centers of Greater Dayton was allocated 900 amongst all 6 of our centers. So we have 900 total doses.
And we're still waiting for a final allocation number. So we'll come back to you when you have an actual allocation number on Sunday.
Zix has 200 doses.
And I don't have a final number for you. Some of our hospital systems are not sticking just within county. They're, it's across the whole system. So
we'll see what we can gather at the state level and we'll get that number to you.
And we do want to remind everybody that the state of Ohio does have a vaccine tracker map on their website that shows the number of vaccines that were distributed throughout the state of Ohio per county. So they are aggregating it in that distribution level at the back end, so you can look there. Obviously, as we grow, the numbers and the number of people who are going to be vaccinating will be growing, and the number of vaccines will be growing on a week-by-week basis.
I have another question, and this might be for Lisa. My understanding is that if you live in, say, Greene County, you can still get a vaccine in Montgomery County. Say they have more and your location ran out. Is that how this will work within the hospital systems?
yeah, I would still suggest going to their website for any criteria because this process continues to evolve as information becomes available, but there's not the hospital systems don't have that same residency requirement that that the public health department.
Do we have any other final questions or any questions?
Yeah, big picture. Obviously, the vaccine has been looked at this entire time as the key to getting out of this pandemic. Is there any statement of optimism that this is the first step in the right direction toward getting to see the light at the end of the tunnel, per se?
I'll start. Absolutely. The world's waited for this for a year. And so we're very encouraged that we now have a vaccine, at least 2. More will be developed and we'll have more supply over time. However, it's really important that we all understand that just because we have a vaccination program, we know that the vaccine can either prevent disease and or minimize the symptoms of disease, similar to an influenza vaccine. But we don't know long-term whether individuals who have been vaccinated can still transmit the virus to other individuals. So it's important that we continue to mask and social distance and so forth. But absolutely, this is the start of what we've been waiting for a long time.
Yeah, and I'll just echo Jeff's comments about just continuing those safe practices. We don't want to make a bad decision when we are so close to light at the end of the tunnel. But I'll say over the last couple of weeks, it has been really exciting to see pictures of, healthcare workers, colleagues, friends who have been able to access the vaccine and have gotten it. And it is just exciting. It feels like it is just a really big step in the right direction. And I'm eager to see that just continue to grow in our region.
Okay, I guess with that, we're going to wrap up our presentation here today. We want to thank everyone who joined us on the panel to provide information to the community. We want to thank our media partners who do a great job of helping us communicate this message to the public. And we want to thank everyone who joined us here on Facebook and on the other streams that you may have been watching today. So stick with us here on Public Health. If you haven't followed us yet, please follow us. We'll be providing updates as we go along. Thanks for joining us.